I'm Diana Robertson-Sheridan. I'm the director of the LVN program at Houston Community College. I'm going to take you on a little tour of the nursing office. This is our nursing suite. Various professors' offices here. You can see we do have areas for students to sit when they are waiting for us.
Hello, my name is Harriet Adedoyin-Tuyo. I'm a full-time faculty member of the vocational nursing program here at HCC, and I've been working here for 9 years now.
Hi, my name is Tony Banks. I'm a full-time instructor with the LVN program, and this is my office.
Hi, I'm Cheryl Brandt. This is my office. I'm full-time faculty with the vocational nursing department. Taught here since 2000. I started here in 2005.
This is one of the parking areas for our students. We are also half a block from the Metro rail station, so students are also able to park and ride in for a much less expensive option. This is the entryway to our 1900 Pressler building. As soon as the students walk in the door, they are able to see the reception area where they can find out any information that they're needing as far as where to report to if they're not already aware. This is the French corner and eating area. Students may get a hot meal along with sandwiches, coffees, snacks, and then they have this whole entire area where they may sit down and relax and have a meal. The gym that the students automatically have membership to whenever they have paid for their enrollment. They may utilize this gym any of the open gym hours, which is pretty extensive, so they can even come and work out in between classes if they would like to and burn off some of that stress. The study areas on the second and third floor of the 1900 Pressler building offers much for the students to partake in. We have many different classrooms that we use for our LVN courses. Room 363 and 581, these are two typical lecture rooms. As you can see, they are very large and they have computer capabilities for the instructor. They also have Wi-Fi ability for the students to be able to hook right into for when we're using technology in class. In the 1919 Pressler building, this is our entry and foyer to what we call the tower. As you can see, it is a very nice and open area. Well lit, lots of windows. We do receptions in here. We have several programs that do their pinning ceremonies here, but it's just a very nice meeting area also for the students. Over behind the meeting area, you can see there's actually individual little study rooms there as well. This study area off of the 9th floor, which is the floor that our nursing labs are on. The study area on the 2nd floor of the Tower 1919 Pressler building, it has many different study alcoves, eating areas, vending machines, ping pong table. So again, areas for our students to be able to come and relax or to study or to eat. Hello again and welcome to the nursing labs here at HCC. So we're going to do a quick walkthrough just to give you an idea of what our labs look like and the capabilities that we have here. We're very proud of our labs, multi-million-dollar labs, and our students get some phenomenal experience here. Our purpose is for them to come here to learn the skill, to practice the skill, to make mistakes here so that they don't make mistakes when they get out in the field. So we're going to do a walkthrough of each of our 4 labs. So as you can see as we go through here, we have different setups. We have pediatrics, we have adults. In here we have intubated patients. You can see all the equipment on the walls. Those are exactly what they're going to see in the hospitals. even down to the Dynamaps. So we try to keep things as realistic and as very real life as possible, and we're very fortunate to have these labs and to be able to have our students to be able to experience these real life scenarios. This is the second LVN lab. One thing that I wanted to point out is that you can see that we have all of these desks in here. So this is important for us because we do pre-briefing with our students. So one of the instructors or more, they will present, these are the skills that we're going to do today. This is why we do these skills. This is how we do these skills. And then we never have more than 9 students per instructor. So the instructors that are in the lab, they will go ahead and divide those students up, and each one of the groups will have an entire half to themselves. But again, our setup here is classroom and lab so that the students, again, get to hear about it first. They get to hear more of the didactic behind the skill. And this is our first ADN lab. You can tell that the setup is pretty much the same. We have the area for the pre-briefing. Some of the skills are a little bit more involved in here because we're at the ADN versus LVN. But like I said, either one of the groups can use this lab. And this is our 4th and final lab. Again, this is second of our ADN labs. And again, you can see the setup is fairly similar. We do have a little bit more on the injection side, IV side, whereas the LVNs, they give injections, but obviously they do not start IVs, but nevertheless, they can do IV therapy. So we have plenty of IV setup over here. And again, the rest of the setup of the room is pretty much the same. We do have chest tube set up even in here. So again, we're very proud of our labs. In here we have our debriefing room. Just like after our students are at clinicals and they have a debriefing session, once they finish with their skills lab, they come into here and they have a debriefing as well. So we really like to have the interaction in here, not just the teacher up here saying, okay, this is what you did wrong. We want the other students to be able to say, hey, I saw that you did this. Why don't you try this next time? So really bouncing the ideas off of each other at the direction of the instructor. So it's very, very helpful at solidifying the information, moving it from temporary to permanent memory when after they've actually done the skills, and then they come in here and they get to talk about it and analyze it, and that really helps to solidify that learning. Here we are on the 10th floor. This is our simulation lab. Again, we are so excited to have this lab. We love showing it off. Television comes in and does interviews here all the time. So I'm just going to show you a couple of the rooms that we have. This one here is actually more of an assisted living kind of room. So we like to give the students the whole picture from beginning of life to end of life. So you can see it is set up very similar to an assisted living room. And as you can see, the unit is set up just like a hospital unit, which is how we intended it to be as lifelike as possible. We have an isolation room. Again, we try to keep things as realistic as possible, and it's ultimately important that our students understand how to function within an isolation room with patients that may be in isolation precautions. Here we have a pediatric intensive care unit. We like to keep things, again, very realistic. Within this room, we have the ability either on the computer or behind the one-way glass that we can program anything to be going on with the patient. So the students have to determine what is going on with them. They have to determine their vital signs. We can program their exact vital signs. So this is an excellent setup for them to get used to that pediatric care, especially on the ICU side. We have many students that are interested in obstetrics. Here in this lab, along with a couple others that we have, you will see we have the full setup of the maternity suite. Everything from neonatal to the actual birthing mamas. And the birthing mamas can actually yell and scream in pain, and they do actually birth the babies as well. Stations are set up very much so just like they would find in a hospital setting. And the last area that we have here is what we call our collaboratorium, or a place where things can be demonstrated. Again, on the computer, we can set up for the mannequin to do whatever we need it to do. We also have the one-way mirror here where on the other side we can actually control it that way. The nice thing that we have is that this can be opened to where the entire class can watch and be a part of it. So this is our debriefing room as well. So as they're watching their peers to do the skills, they are able to give immediate feedback to enhance that learning